In this video, we are learning about stroke volume. Stroke volume is the volume of blood pumped out of the left ventricle each time the heart contracts. The heart contracts and relaxes. The relaxation time is called the diastole. During relaxation, the heart is filled with blood. The volume of blood at the end of relaxation is called the end diastolic volume or EDV, and this is usually around 130 ml. After relaxation, the heart will contract to push the blood out from the left ventricle via the aorta. The contraction time is called the systole. At the end of the ejection of blood, not all blood is ejected, some will still remain, and this is called the end systolic volume or ESV. It's usually around 60 ml that will remain. This is how we calculate the stroke volume. It's calculated by EDV minus ESV, that's end diastolic volume minus end systolic volume. So 130 ml minus 60 ml, that will give us 70 ml. So 70 ml is the amount of blood that is ejected out of the heart each time the heart contracts, and that is called stroke volume. Cardiac output is the amount of blood ejected from the heart per minute. It plays a vital role in tissue perfusion. The heart pumps about 4.9 liters of blood per minute. The blood provides oxygen to organs and tissues of the body. When cardiac output is too low, there will be decreased tissue perfusion. When tissue perfusion is decreased, organs will not receive enough oxygen and they will start to die. Cardiac output is determined by two factors: the stroke volume, which is the volume of blood ejected by a ventricle in each beat, and heart rate, how many times the heart beats per minute. So cardiac output equals to stroke volume times heart rate. What is preload? Preload is the stretch that the blood places on the wall of the ventricles at the end diastolic volume. When the heart fills with the blood, it stretches it. At the end of the filling, the degree of stretch on the walls of the ventricles is called preload. The more the heart is stretched, the greater the contraction to eject blood. What is afterload? Afterload is the resistance which the heart must experience to eject blood. We can also say that it's the pressure the ventricles must work against to open aortic valve in order to pump blood out of the heart. Afterload is like the knot at the end of the balloon. To get air out of the balloon must work against the knot in order to come out. Thank you for listening. Please don't forget to subscribe.